Hello friends, today we are going to discuss about civil medical negligence. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMHANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only, not for legal opinion. If you want to have a legal opinion, please do contact an advocate. Conflict of interest? None. Let's understand the concept of civil medical negligence. How is it defined? How the concept to be understood? What are the different readdressal mechanisms are there in civil negligence, and also how is it assessed? All these will be discussed in this video. First and the foremost, what is medical negligence? A doctor owes certain duties to his patient, and a breach of any of these duties gives a cause of action for negligence against the doctor. So, my dear friends, medical negligence is very clear. There is a duty of care towards the patient, and if there is a breach of this duty which causes injury, which results in damage, that needs to be compensated. That is called as medical negligence. And the impact of medical negligence, and the medical negligence can be of three different types. One is criminal, where the negligence is very gross, which leads to punishment of the doctor. The civil is basically compensation in the form of money given. That is where the negligence is of milder form, not to that level of gross negligence. And the third one is if the doctor does not follow the ethics code of conduct, then his license can be removed to practice. However, my dear friends, please do remember, the patient can approach all the three: criminal, civil, and also to remove his license to practice. All three are valid for a readdressal mechanism. But however, in this case, we are going to discuss only civil cases. To have a medical negligence with regard, if it is a gross negligence, then it will be criminal. If it is a simple negligence, it is civil liability. If there is a professional misconduct, which the code of conduct has been violated, then the doctor's license will be cancelled. Where the patient can go for readdressal, it can go for all the three. But however, with regard to civil, criminal, and NMC, he can approach all the three. But however, with regard to civil cases, he can go to civil court if he has not paid any service charges. That means if he has taken a free treatment, still he can go to civil court. If he has paid, he has a now option to go to consumer court. The third one, he can go to clinical establishment or private clinical establishment act. Under that, he can give a complaint. And the third one is commission, that is Human Rights Commission, Women Commission, and Child Commission. In all these cases, the civil case can be lodged. And the third one is, of course, in the National Medical Commission to remove his license. Now, let's understand what is civil medical negligence. Again, in the civil medical negligence, there are three important components: duty of care, breach of duty, and damage which is resulted because of the breach of duty of care. And the causality of the breach which results directly with regard to damage. That means the relationship between the breach of duty which leads to injury and the damage should be directly related, and it should be proximate, not remote. That's what the third point is. But however, here the Bolam test comes into play. The Bolam test clearly says a doctor would not be held liable only if he has acted in accordance with the practice accepted by a reasonable and responsible body of medical men skilled in the particular act. That means if the doctor is able to follow one of the standard practice which is prevailed at that time for a particular illness, he is not negligent. That means the professionals in his specialty clearly said that he is following the standard procedure of protocol, then he is not negligent. Further, a person who does not have any knowledge of a particular system of medicine but practices that system is a quack. That means if a homeopathic doctor practices allopathy, and if there is a negligence, that per se it will be considered as negligence and no further proof is required. That's what the Supreme Court has said in case of Poonam Verma versus Ashwini Patel in 1996. Further, the burden of proof. The burden of proof in civil cases is invariably on the complainant, that is, on the patient or the patient party. And they have to prove all the three things. They have to prove that there is a duty of care existed, and because there is a breach of duty which resulted in injury, and that injury has caused damage which can be compensated in the court of law, and all the three needs to be proved in the court of law by the patient or the patient party. But however, the patient need not prove in case of res ipsa loquitur. It means if the act speaks by itself. That means the onus shifts towards the doctor when the maxima of res ipsa loquitur occurs. In Ravi Shankar versus Jerry Thomas case, a patient goes to a doctor and nasal septal surgery is done, and the doctor forgets to remove the gauze which is there in the right nasal septum. The patient subsequently comes back to the doctor and says, "I'm still having pain and infection." The doctor gives antibodies. Basically, he gives antibiotics. But the patient doesn't improve. And he goes to St. John's Hospital, where the CT scan was found. In the CT scan, it was found that there was a gauze left behind in the right nasal cavity. And that it clearly said that res ipsa loquitur. That means the Supreme Court was very categorically said that the act speaks by itself and the doctor was held responsible. Here, there is no need to prove negligence. That is the maxima of res ipsa loquitur. Coming to the landmark decision about Kusum Sharma versus Batra Hospital, especially with regard to civil negligence, we are going to discuss about this case now. In this case, Mr. X, a senior operational manager in Indian Oil Corporation, has breathlessness, generalized edema, and difficult to control hypertension. So he visits one of the Mulchand hospital. They did all investigation, but the hypertension was not controlling and he had edema. Hence, he was referred to Batra Hospital in March 1990. The Batra Hospital ordered for CT scan and ultrasound. In the CT scan, they found there is a smooth surface mass on the left adrenal, that is on the left kidney. This left adrenal mass was measuring 4.5 into 5 cm. Hence, they decided for elective surgery. The elective surgery was performed on 2/4/1990. During the operation, there was a damage to the pancreas. Since there was a damage, the surgeon realized, hence a drain was kept. Further, since the drain was kept, the second operation was also repeated. But unfortunately, the patient developed fistula. And at the same time, the mass report also came back, which clearly said that the patient had malignancy. Since the patient's condition was not good for chemotherapy or radiotherapy, they did not go ahead with that. At the same time, the patient's wife clearly said that, "Please don't reveal my husband is suffering from malignancy. He may not be able to take the diagnosis of cancer." Hence, the diagnosis of cancer was not mentioned on the discharge summary. Post-operative pancreatic care and fistula care was also called for. He was called in August 1990. He was done dressing. Further, the patient was not happy. Hence, he went to AIIMS Delhi. He was also admitted for 2 or 3 days there. And again, a procedure for fistula and pancreatic fistula was conducted. The patient left to Mahatma Gandhi Hospital care in Jodhpur. There he had high fever. They started some antibiotic and they also said that you go back to AIIMS Delhi. In October 1990, the patient developed a high fever and he developed pyogenic meningitis and he dies. This was the case which resulted the death of the patient, where the wife of the patient becomes very angry and takes the Batra Hospital to the Supreme Court. The National Consumer Forum and the Supreme Court both dismissed this case, telling that there was no negligence and the complainant could not establish any kind of negligence either on the Batra Hospital or any other hospital. Apex Court also said that unnecessarily accusing the doctors of negligence will lead to defensive practice, which is not good for the society. And the doctor should not be worried whenever he is doing any surgery or treating a patient who has high risk. Whenever there is high risk and a severe illness, the doctor has to choose to perform surgery which may be risky. In such a situation, if you threaten the doctor with medical negligence case, he may not take the case. Hence, they clearly said that there was no negligence in this case. However, further the Supreme Court went ahead in this Kusma Sharma versus others Batra Hospital, clearly deciding about the medical negligence. It laid down some important principles. Those important principles we are going to discuss now. First principle: negligence is a breach of duty exercised by omission to do something which a reasonable man, guided by those considerations which ordinarily regulate the conduct of human affairs, would do, or doing something which a prudent, reasonable man would not do. This first principle is very essential. In this, the Supreme Court clearly said that the act of omission and commission which a reasonable person will not do in that profession, then only the essence of medical negligence come into play. That is the first principle. The second principle: negligence is an essential ingredient of the offense, especially with regard to criminal responsibility. In the negligence to be established for a prosecution must be culpable or gross, not the merely based upon error of judgment. The doctor is a human, he can do errors. That cannot amount for negligence. And if you are doing a criminal negligence, it has to be gross, culpable negligence. Then only the criminal case can be put against the doctor. That is the second principle. Coming to the third principle, the Supreme Court clearly said that the medical professional is expected to bring a reasonable degree of skill and knowledge and must exercise a reasonable degree of care. What a wonderful lines. Reasonable degree of skill, reasonable degree of knowledge, and a reasonable degree of care should be given. It does not expect very high degree of care or a low degree of care. It requires a standard reasonable degree of care. An amazing third principle being put down by the Supreme Court of India. The fourth principle: medical practitioner would be liable only when there is his conduct fell below that of the standard of a far reasonable competent practitioner in his field. That means the doctor who is performing any surgery or his treatment or any investigation, his conduct should fall below the standard of a reasonable competent practitioner in that field. Then only he will be held responsible. Coming to the fifth principle, the realm of diagnosis and treatment, where there is a scope of genuine difference of opinion. And one professional doctor is clearly not negligent merely because his conclusion differs from other doctor. In a case where there may be multiple diagnoses, in such a scenario, the doctor will not be held responsible if there is a genuine difference of opinion with regard to diagnosis and management. That means the Supreme Court has allowed the human error can exist in medical practice. What a wonderful principle 5. Coming to the principle 6, the medical profession is often called upon to adopt a procedure which involves a higher element of risk, but which he honestly believes as providing a greater chances of success for the patient rather than procedures involving a lesser risk but a higher chances of failure. Just because a professional looking to the gravity of illness has taken a greater risk of element to redeem the patient out of his or her suffering, which did not yield the desired result, may not amount to negligence. Dear friends, please you have to remember here, sometimes the doctors are called to deal with the very risky, difficult, fragile cases. And the doctor has to take a decision, either to go ahead with the surgery, which he may lose the patient. But if he is successful, the patient will be completely free from his problem and he will walk out healthily. Or else, the doctor can choose a risky, less risky procedure, but the outcome will be bad. In such a scenario, you should not hold the doctor responsible just because there is a negative outcome. This is the sixth principle. Seventh principle, negligence cannot be attributed to a doctor so long as he performs his duties with reasonable skill and competency. Merely because the doctor choose one course of action in preference to the other one available, he would not be liable if the course of action chosen by him was acceptable by the medical profession. That means here also the Supreme Court was very clear. It clearly said that just there are two different of school of thoughts. If the doctor has chosen one, and he can't be held just negligent because he has chosen one course over the other course of action. Coming to the eighth, it would not be conducive to the efficiency of the medical profession if no doctor could administer medicine without the halter around his neck. What amazing words. Imagine if a doctor is made to do a procedure having halter around the neck, telling that if the case fails, we will hang you to death. Imagine whether the doctor will be able to perform the procedure. That's what the Supreme Court has said in the Principle 8. Coming to the Principle 9, it is bounden duty and obligation of the civil society to ensure the medical professions are not unnecessarily harassed or humiliated so that they can perform their professional duties without any fear and apprehension. Don't just harass the doctors. That's what this meaning. Coming to the 10th, the medical practitioner at times also have to be saved from such a class of complaints who uses criminal process as a tool of pressurizing the medical professional or hospitals, particularly private hospitals or clinics, for extracting uncalled for compensation. Such malicious proceedings deserves to be discarded against the medical practitioner. So this is again a wonderful point where the court has acknowledged there are psychopaths who just want to extract money from the private practitioners and private hospitals. They will give complaint and ask for compensation. That needs to be stopped. Coming to the 11th, the medical professionals are entitled to get protection so long as they perform their duties with reasonable skill and competence in the interest of patient. The interest and welfare of the patient have a duty to the paramount for the medical professionals. So this is a wonderful point where if the doctor is doing his duty with reasonable degree and skill and competence, he needs to be protected under the law. To summarize, my dear friends, every doctor has a duty to act with a reasonable degree of care and skill. Negligence is the breach of legal duty to care. And because of this breach, there is an injury which resulted to damage, which can be compensated. The practitioner must bring to his task a reasonable degree of skill and knowledge, neither very higher nor very low degree of care. The court wants the reasonable degree of care. An amazing decision which has been taken by the Supreme Court. Thank you very much for your valuable time. Stay safe.